Welcome to launch day of End the Pandemic campaign for global vaccine equity and access, a campaign in support of UNICEF USA's End the Pandemic campaign. My name is Devorah Joseph Davey, and I'm an epidemiologist based in South Africa, Cape Town, South Africa, working from the University of California, Los Angeles. As a public health expert, I'm passionate about health equity. Today, we're going to talk about global vaccine equity. Vaccine inequity leaves lower income countries, many of them in Africa where I live, at the mercy of COVID-19 and future variants. Today, more than half of the world's population has been vaccinated. However, 84% of Africans have yet to receive their first dose. And this is more acute in rural areas in Africa. Currently, only 5 of Africa's 54 countries met the target to vaccinate 40% of their population by the end of last year. And there's inequities within specific regions and countries. We know there's stark differences in vaccine distribution between high income and low and middle income countries are the main reasons for this inequity. And the inequity in vaccine distribution combined with the limited vaccine supply means that low-income countries remain at risk of remaining behind in the global recovery. And there won't be a global recovery if we continue to have this inequity in access to vaccines, to testing, and to antivirals. As most of the people in the African continent remain unvaccinated, new coronavirus variants can easily emerge and trigger new waves globally. All of us need to work together to become public health champions. I'm also passionate about mobilizing young people in the broader Jewish community in support of global vaccine equity. Today, I'm happy to be part of the End the Pandemic campaign, which supports UNICEF's work overseeing the procurement, storage, and delivery of COVID-19 vaccines to the world's most vulnerable people, including in low-income communities. As the world's largest provider of childhood vaccines, UNICEF has been entrusted with the mission by global health organizations because it has the infrastructure, expertise, and experience to successfully carry it out. And according to Jewish tradition, preserving human life overrides virtually all other commandments. This campaign offers those of us who have been privileged to receive free vaccines and tests and even boosters and more boosters the opportunity to pay it forward, by giving someone else in a low-income community or a low-income country the chance to protect themselves, their families, and their community. We're thrilled to kick off this campaign and call to action by speaking with 2 leaders working to ensure global vaccine equity. Diana Ginsburg is the CEO of Olam, and Andres Kragulant is UNICEF USA's Assistant Director of Emergency Coordination. Let's get the panel started with introductions. Diana, we will start with you. Please share with us today why this cause is important to you.
Thanks so much, Devorah. It's a pleasure to be in conversation with you and with Andres. As you mentioned, I am the CEO of Olam, which is a network of over 60 Jewish and Israeli organizations that work in the fields of international development, humanitarian aid, and global volunteering. And Olam's work is really focused on engaging Jewish leaders with global issues, bringing together Jews who work in low-income countries, serving the world's most vulnerable, and increasing the visibility of global causes in the Jewish community. I am passionate about this issue because it was clear to me from early in the pandemic that this is a unique moment in history when all of humanity is experiencing something together at the same time. But it was also clear to me early on that while we may be in the same storm, we are not in the same boat. And as you mentioned, Devorah, the pandemic has demonstrated all too clearly the existing inequities and has compounded and revealed inequities. And this, as you mentioned, is very clear when it comes to vaccine access to COVID testing, and all other parts of the COVID spectrum. I live in Israel and personally have received 2 doses plus a booster. And just last week, I got an email invitation from my healthcare provider inviting me to come in for a 4th dose. And so for me, my involvement in this campaign comes from a deep sense of gratitude, also coupled with an awareness that so long as we allow this virus to spread, we endanger precious lives around the world and risk even deadlier variants. And in a world as deeply interconnected as ours, this is bad news for all of us. And I will just say that today, this got even more personal for me than it has been up until now, because just this morning I tested positive for COVID, and 3 out of the 4 members of my nuclear family are also sick with COVID at this moment. But thanks to the vaccines that I've had the privilege to receive through through no work on my own part, I don't fear the worst. I know that, the next couple of days may be challenging, but I am deeply grateful for being in the place where I am, where this is, a nuisance and a minor health scare. But I do know that my family is safe.
We wish you and your family a speedy recovery, and I hope the symptoms are mild. Andres, why is this important to you?
Thanks, Devorah, and the same, Diana. Hope you and your family feels well soon. Thanks again for having me here today. I look forward to today's conversation. I think as Diana mentioned, everybody has been impacted by this pandemic in one way or another. Everybody sitting on this call, everybody across the world, really. Personally, this is an emergency that I've been working on coordinating for the last 2+ years from my small perspective. But as much as it has impacted me or my loved ones, tackling vaccine inequity is really an effort that truly helps us bind us through our own humanity. We know that we are not safe until all of us are safe. So really recognizing that we are all in this together has been something that has really stuck with me throughout these last 2 years. So with that said, I'm very thankful to be working with partners like you all, like Olam, to ensure that we can provide COVID-19 tools to the most vulnerable people around the world, and we get one step closer to ending this pandemic. Again, really happy to be on this call and look forward to the conversation.
Thank you so much, Andres. So the first question that I have is over to you. Let's look at the current status of global vaccine access and delivery. So why are we still talking about this? If we've all had our boosters and all of that, so why are we still talking about this? Can you share the current status of vaccine access and delivery? What are some of the successes and challenges with distributing vaccines? And how are the funds going to be used from the End the Pandemic campaign? How will it support your efforts in the coming year at UNICEF USA?
Thanks for the question. Well, as of today, we can mention that 1.17 billion doses have been delivered to 144 countries by UNICEF and partners. But it's also important to recognize that there have been some challenges along the way. As you all may remember, there was a second wave of COVID-19 cases in Southeast Asia, and particularly India, that impacted not just the population there, but it also had secondary impacts on global vaccine efforts. Understandably, vaccines needed to be redirected towards supporting the needs of those populations, but this will also reduce global availability for COVAX. This is still having an impact today. In fact, there are 3 main challenges that are impacting COVAX and the rollout. One is, as I mentioned, the timing and extent onto the export controls that are being eased in India. While vaccines started being exported from India recently, we're still trying to get an exact volume and phasing of those volumes underway. Second, we're also working with manufacturers to prioritize supply from global manufacturing networks to COVAX. And lastly, it's really just expanding our supply. So that includes timely regulatory approval of candidates that COVAX has already signed deals with. So once we get those additional candidates on board, that increases our overall supply. So all of these different challenges are impacting us. But that being said, with these setbacks still in mind, UNICEF has to really work with its partners to have a robust supply in line currently. We are now aiming to roll out and deliver 4 billion doses by the end of 2022, including the 1.17 billion doses that we delivered as of today. And with your support, we can build on the achievements we achieved last year. UNICEF and partners actually are doubling down on 2 programmatic areas. 1, to scale up in-country delivery of the vaccines, and 2, really to increase the adoption and trust of these vaccines, other COVID-19 tools, such as tests and treatments in low and middle income countries. So as I mentioned, we know that vaccines are not the silver bullet. We know that we have to also tackle this pandemic through COVID-19 tests and treatments. So UNICEF is also aiming to deliver 21 million diagnostic tests by the end of the year and support up to 20 countries with oxygen treatment. That way we can effectively track and treat emerging cases in case there are additional variants while protecting communities with vaccines.
That's great. I think that's a really good point. It's not just the vaccines alone that are going to end the epidemic. And we know there's a lot of hesitancy with the vaccine that needs to be addressed. And also just the tools to be able to do the internal distribution, like I was saying, to rural areas or less areas with less infrastructure. So Diana, why did Olam feel compelled to get involved in this issue of vaccine equity? And why should Jewish communities get involved and give?
So as I mentioned earlier, part of Olam's mission is to mobilize the Jewish community around global issues and to create a more just and compassionate world for all. And so as vaccine rollout began here in Israel, where I live, and in the United States, where I'm from, and in the UK, where Olam has a strong presence, it was clear to me that this was something that the Jewish community should get involved in. And in fact, one of my first emails to try and wrap my head around this was to you, Devorah, in which I was trying to figure out what is a productive role for the Jewish community, and in particular for Olam. And early in 2021, when vaccine rollout was starting to progress in those three geographies, it wasn't entirely clear. It seemed that a lot of the emphasis was on governments, pharmaceutical companies, high-level advocacy. And where Olam really excels is in mobilizing Jewish leaders and individuals. And then a few months later, a campaign fell into our lap in the British Jewish community. And it was a campaign that was an interfaith campaign where we joined forces with the chief rabbi of the United Kingdom. And he and his office were partnering with the Archbishop of Canterbury, the Mosques and Imams National Board, to support UNICEF's work on global vaccine access around the world. And within the British Jewish community, this garnered significant attention. In fact, the very first week that we were involved in this campaign, it was the major headline in all three Jewish media publications. And Olam played a role in terms of engaging Jewish leaders, creating a toolkit for Jewish educators, etc. For a variety of reasons, a year has passed since the work that we did in the British Jewish community. And now we're rolling out a similar campaign in the US to support UNICEF's work. But I actually think the timing now is really important. One of the things that I've been experiencing with Omicron, at least where I live, is a general sense of pandemic fatigue or complacency. There's definitely talk of, the pandemic being over, a light at the end of the tunnel, etc. And I think if there's one thing that Jewish tradition cares deeply about, it's not being complacent and not taking things for granted. In fact, there is a quote that I am particularly fond of by the former chief rabbi of the United Kingdom, Rabbi Jonathan Sacks, who says that Judaism is a sustained struggle, the greatest ever known, against the world that is in the name of the world that should be, but is not yet. And a core principle in Jewish tradition is that of not taking things for granted and expressing gratitude. In fact, the first prayer traditionally that Jews say every single morning is Modeh Ani, I give thanks. And so what does it look like at this moment in time where, the American Jewish community or the Israeli Jewish community where I live, may be in this place of pandemic fatigue or compassion fatigue, to step outside of ourselves and really feel the weight of the fact that this pandemic is not over for very many people around the world. Here in Israel, 74% of people have had at least one dose. And, you know, as you mentioned, Devorah, earlier, that is not the case in low-income countries. You know, I look at Burundi, one of the world's poorest countries, where I believe the current number is 0.1% have received a dose. So that gap is staggering. In Olam's network, there are several of our partners who have been involved in the fight for global vaccine equity. One of our partners, IsraAid, an Israeli humanitarian NGO, sent a delegation of public health specialists at the invitation of the government of Eswatini to consult on the COVID vaccination program. In India, another partner of ours, Gabriel Project Mumbai, has been working with local health authorities to provide COVID tools to the rural villages it serves year long. And American Jewish World Service, one of our core partners in the US, has been working closely with its partners in Africa, Asia, Latin America, and the Caribbean to prioritize vaccine access for marginalized communities and simultaneously lobby the US government on this issue. But what is clear to me, in tandem with all of these efforts were significant, it's really important for the Jewish community to have a seat around the table for, you know, the largest multi-sector global efforts tackling this issue. And that is why it is our real privilege to support the End the Pandemic campaign, why I feel that in order to make an impact at scale, we need to join forces with larger entities. This is not an issue that a single business, a single donor, a single nonprofit, a single individual can tackle by himself or herself. It's only by combining our collective resources that we can make a dent in this significant task before us.
Really important what you're sharing, Diana. Thank you so much. So Andres, next question is to you. One of the biggest factors is overlooked, adding to the problem of inequity in vaccine distribution between and within Africa countries. So it's between the African countries and within African countries. How will UNICEF address this specifically in Africa to make sure that vaccines are delivered safely, including that they're not expired, they're manufactured safely to populations in these low-income communities?
Thanks, Laura. And that's a great question. So UNICEF is doing this in different ways. First, I'll talk about what UNICEF is doing specifically in the continent of Africa, and then I'll walk through the general process. In addition to those deliveries that UNICEF is providing through COVAX, UNICEF also partnered with the African Union and specifically the African Vaccine Acquisition Trust of the African Union. Through this trust, what it intends to do is ensure that the African population is vaccinated up to 60% way through by complementing initiatives such as COVAX. So UNICEF is delivering doses through COVAX, delivering doses through AVAX, and then helping with in-country logistics. So what we're seeing as a result of that is that we're not only delivering the 1.17 billion doses across the world, but in addition to those, which many of those are in Africa, 36 million additional doses have been delivered by UNICEF and partners to 41 countries in Africa, recognizing the inequity in that continent. In addition, just to take a step back, there are three main buckets that UNICEF works in with partners to ensure that there's a safe and effective vaccine being injected into people's arms at the end of the day. One is at the beginning of the pandemic was upfront preparation. So this included market assessments with vaccine manufacturers, mapping out cold chain equipment to really understand where the gaps are in different countries around the world and where we could make sure that those gaps are improved. Forecasting demand and understanding the different contexts in which different populations may see the pandemic, how we can improve the understanding of how the COVID-19 tools help and things like that. After this upfront preparation, there's also a lot of work going into the national vaccine deployment plans. So UNICEF provided technical guidance to countries to make sure that their vaccine plans are updated and adapted to the vaccine rollout for COVID-19 specifically. After that, there's an advanced purchasing step in which we secured funding for the procurement, advanced purchase agreements went into place for the vaccines, but also early buying of the cold chain equipment that we had already mapped out. Then also there's the safe injection equipment. So it's bundling, stockpiling, and really just making sure that those devices and whatever is needed before the vaccines get to countries are already there, so we could already be ready. And lastly is, of course, the delivery. And this is where we're really working with donors and partners like Olam to really get this ball rolling, because it doesn't matter if we all do all of this and the vaccines just stay in tarmacs. We really have to get them from the tarmacs to arms. So all the work in the upfront preparation that we did now comes into play. So that includes all the training of the healthcare workers, all the cold chain that we had mapped out is locked and ready to go. All the logistics in terms of the transportation to make sure that vaccines go from urban areas to rural areas, and also the demand generation piece. We're not only making sure that we're doing activities to promote the demand, but we're also recognizing that we analyze that information against the actual vaccination rates. The next time there's a new batch of vaccines available, we can improve and tweak these demand activities to make sure that we continue to adapt with whatever the questions that the communities may have, so we can continuously improve our work. Lastly, I do want to dive a little bit deeper into what delivery looks like from availability to delivery. So there's really a repetitive or recurring process in which manufacturers in a monthly basis are telling UNICEF and partners how many doses are going to be available that month. UNICEF then works with countries through their national vaccine deployment plan to understand which doses they can accept, refuse, or defer for that specific allocation. UNICEF then maps out all the different doses that are available for different countries and the quantity of those doses, and then prepares it for the actual delivery. So that includes a purchase order for those specific amounts, and then we're able to get the ball rolling of getting the doses from tarmac to arms. So all of these pieces are coming to play to make sure that at the end of the day, the safe and effective vaccine is in people's arms. And this includes areas such as Africa, where there's still a lot of vaccine inequity work to do, in Southeast Asia, everywhere around the world. I do encourage folks, if they're curious about the day-to-day rollout, you could look up online vaccine market dashboard UNICEF, and you can see every single day how many doses we delivered and to which countries. So I really encourage you to check out that resource. But yeah, that's the general gist of how we work to make sure that the vaccines are safe and effective.
That's great. Oh, that's really informative. And thank you for sharing the link. So I don't know if there's any questions now. If anyone has any questions, please share them in your chat on Facebook or Instagram. And while I'm waiting for questions, I'm just going to leave it over to Diana and Andres. Do you have can you share any closing thoughts in response? What does a fully vaccinated world mean to you? I'll start with Diana. What does a fully vaccinated world mean to you?
Sure. So for me, it means that we have come together as a global community and seen the best in humanity. It means that no matter who you are or where you were born, that you are protected from this illness and that you are able to pursue your basic livelihood. It means that our own life cycle events and our own communal fabric will be filled with our loved ones and neighbors, and we can spend time together in person building community. And for me, it really means that we have fulfilled a larger vision to both ensure our own health and safety, but at the same time, protect those around the world who are at most risk, the elderly, healthcare workers, immunocompromised. As part of this campaign, we have mention the Talmudic dictum that whoever saves one life saves an entire world. And that's why I think this particular campaign, which is built as a crowdfunding campaign, is important, because even with a small donation, it can go a long way. As Andre spoke, to get a vaccine from Tarmac into people's arms is not a lot of money. It is within the wherewithal of those who are, listening to this live broadcast right now. And I'll just use this opportunity to share how other people can get involved. So as I mentioned, this is a crowdfunding campaign. We have called upon Jewish leaders, communal leaders, influencers who have sizable social media followings, rabbis across the political and religious spectrum and across various geographical regions, particularly within the United States, but also elsewhere, to post and share this campaign over the next 7 days on social media. What we've learned from this pandemic is that our own individual actions have the ability to impact people far away. And here too, in this particular campaign, we believe that one individual who mobilizes their own friends, their own family, their own community, uses their own social media platform to amplify this message can make a significant difference. We have well over 70 Jewish leaders, influencers who have already signed on to spread the word. We encourage everybody who is listening here to donate via the link that I believe is being put into the chat. And getting involved is as simple as making a donation, small or large, posting on social media and tagging others to do the same. We have already, this is the launch, but over the last day or so, already seen people posting and donations coming in. So the movement is growing, and we hope that more and more people will join us in this important effort. So please do click on the particular link. And that link does open up a pop-up window on the End the Pandemic campaign site. If you would like your donation to be attributed to that of the Jewish community, then we would encourage you to donate through that particular pop-up window, because then we can track donations coming in from the Jewish community.
And Andres, what does a fully vaccinated world mean to you?
So when you first asked that question, Devorah, I think the first images that came to mind were folks and friends and family gathering more around their table more frequently, healthcare and other essential workers really getting a vacation or some rest from these last 2 years. And I also see this, as Diana mentioned, a way to kind of improve and build better and build our humanity in a stronger way, to use the lessons we gathered, the infrastructure, the cold chain, all the other tools we invested in as a first step into strengthening healthcare, education, child protection systems across the world. We have seen that these systems are fragile. So by doing so, we are not only protecting our most vulnerable, our elderly, our immunocompromised, but we're really working to build a world that's better for children to survive and thrive. So I think through these types of partnerships where we could all understand how we're in this together, it really drives the message forward of not just ending this pandemic, but building a stronger world and a better world for our children and our communities, and where we could build community in a stronger way.
I feel the same way. I can imagine the healthcare workers being able to take a holiday, take a vacation, and families getting together. And I always think about going back to, going to a concert, going somewhere where everyone is together and having a good time and sharing music together and celebrating together. So that's what I think of as well. Thank you so much to Diana and Andres today, to Olam and UNICEF for all that you are doing, for all that we're all doing to ensure global vaccine equity and access. We hope you will join us today in this important cause by donating through the link that we're sharing It's important that you make your gift via the pop-up window, like Deanna just said. Post, share, and tag with your friends on social media and encourage others to give. Thank you all for being here. The world isn't safe until we're all safe and we all have access to vaccines and other COVID treatments and testing. Thank you for doing your part today to ensure that the world gets vaccinated and that we can end the pandemic together. Thank you.